Coming up on Fox on Health, a study on the safety of breast implants. That's next, so stay with us.
But first up, a new study from the Mayo Clinic has found that many women who get breast implants will require further surgery. 25% will need surgery to repair complications such as infection, deformation, hardening, and pain. And those who get implants after mastectomies for cancer are nearly 3 times as likely to have surgical complications than those getting them for cosmetic reasons. And here with the details from New York's Beth Israel Hospital is plastic and reconstructive surgeon Dr. Derek Antel. Thank you, Dr. Antel, for joining us.
Thank you.
Explain this study to us and what it's actually saying to us. I mean, we ran it down there, but what does it mean to people?
Well, Carol, I think that you gave a good capsulization of it. I think the key thing is to understand that in terms of this study, our first responsibility is patient care. We're looking at this study, and it is really not anything new in terms of previous studies that have been published in terms of the complication rates. The key thing that you said is that in cosmetic surgery patients, the rate is about 1/3 of what it is in reconstructive surgery patients. And that's primarily because we're dealing with somewhat damaged tissue in a reconstructive case, and we have to restore that tissue in terms of form and function.
And what are some of the complications that we're talking about that require the surgery?
Well, if you look at that study a little bit more carefully, the most common complication was capsular contracture. Now,
can you explain that too?
I knew you were going to ask that. Anytime you put any foreign body in the body, any implant, whether it's an aortic graft, a pacemaker, or a breast implant, the body wants to wall it off. So the body creates scar tissue around it. Now, if that scar tissue contracts down, it can be firm to the touch. You wouldn't be aware of it if it was internal, but when it's in a breast, you can feel it, and it may feel a little bit hard, or it may feel a little bit firmer than a natural breast. And that's really what we're talking about as the primary complication.
Now, let's break it down. Cosmetic surgery. When to your knowledge, do these problems start to surface when you've had cosmetic surgery?
In the cosmetic surgery patient, as in any surgical patient, most complications occur in the early time frame. The later,
a month, 6 weeks, 2 months?
60 days.
60 days.
60 days. Long-term complications can still occur, but the frequency goes way down.
Now, when you're talking about mastectomies, when do you start seeing problems if they're going to occur? And we know that there's a good chance they will.
Sure. Problems will occur in a mastectomy patient in that same time frame as well. Most of them will occur in the early time frame because that's when you'd be most likely to see things like infection or damage of the tissue where it wouldn't heal quite right over the implant, but you can still get complications long-term as well.
Can you give us an idea of what kind of surgery we are talking about now to correct the problem? What's involved with that?
Well, as I mentioned earlier, the most common complication that was listed was capsular contracture. That's a shrinkage around the implant. The surgery to correct that involves opening up the pocket and scoring the scar tissue around the implant. So if you think of the scar tissue as being sort of a dome, you'd want to cut around the dome and across the tops. And what that does is releases it, sort of like a parachute opens and releases.
And it's very briefly successful most of the time?
Oh, yes.
Okay. We'll be back in a moment to talk more about this. If you have any questions, please give us a call at 1-888-TEL-FOX. We're ready to hear from you. Stay with us. Welcome back. We are talking with Dr. Derek Antel about the safety of breast implants. We have a caller on the line, so we want to go to that right away. The caller is Debbie calling from Traverse City, Michigan. Hi, Debbie. Thanks for calling.
Thank you.
Okay.
This is a concern that I have in relation to the hardening of the scar tissue around the implant. Is it possible to correct that by pressure, basically squeezing from the outside to break that down rather than the surgery?
That's a good question.
Well, Debbie, to answer your question, squeezing from the outside is a technique that we used to use fairly often. It was done commonly with the silicone implants. The problem is that you would literally put your hands on the breast and forcibly squeeze, and what you were doing is tearing that scar tissue. You'd pop it like a pimple. And you could also pop the implant at the same time. So it's not really recommended to be done today. And with the saline implants, if you damage the implant, it would cause immediate rupture of the implant.
All right. you brought us to our next topic, and that is the difference between the silicone and saline implants. And we do have some implants here that we can discuss, so you can pick one up and show us which one is which and what are the pros and cons.
What I'd like to show you initially is an empty saline implant. This is basically an empty bag. It's like a water balloon. We fill it up through this valve, and the advantage of these implants is you can roll it up like a cigar so that you can put it through a very small incision. Once it's inside, it opens, and then you can fill it up with a filling tube. Now, when it's filled, it looks like either of these two implants. These are both saline implants.
The difference here. Okay.
Now, these are
this is just the outside material is different on this one than it is on that one. What is the difference, and why do they vary so much? Because this looks rather...
This is a textured saline implant. Some doctors prefer this. In certain cases, they might prefer this implant over the smooth wall implant. They're both filled with saline, though, which is salt water. It's the same fluid that's in an IV. Now, this is a silicone implant. This is sort of an average-size silicone implant. This one happens to be what we call 250 cc's.
I suppose I should tell our audience, since I have the benefit of feeling this, that this feels very, very different from the saline solution implants. What are the pros and cons? What are the benefits? So we've heard a lot of things about the silicone implants that have essentially never been proved scientifically, but nonetheless people have been very upset and said that they individually reacted to them. So can you give us the rundown?
Well, the same study that just was published, a similar study was done by the same group of doctors over the issue of autoimmune disease. And they showed in their study, as was shown in approximately 20 other studies in 6 foreign countries, that there is no relationship between those two factors. So these same doctors are looking at other issues, and in this study they looked at local factors. That means things like deflation of the implant, hardening around the implant, which we talked about, infection, things that are seen with any surgical procedure. Any operation that you have has the risk of infection.
All the variables. All the variables. Okay. Which ones do you recommend? Are more and more women asking for the saline implants?
Well, the saline implant is really the only implant that I believe most doctors are using today. The silicone can still be used in reconstructive surgery, but most of my colleagues, and here in New York, I believe that virtually all of us are using the saline implants. I prefer this saline implant in the majority of cases. Now, this implant is slightly overfilled for demonstration purposes. This is not the texture of what it would be in the body. It would be softer than this. The implant tends to, because it's water-filled, assume more fill on the bottom so you can get more of a breast shape.
Is there any use of soybean oil? Is this a new sort of cutting edge?
Well, that's an excellent question, Carol, and people are looking at that. They're looking at other types of additives. Soybean, peanut oil has been suggested. The problem with some of these additives is partial reaction to it, such as allergic reactions. You know, some people are allergic to peanuts. They can die, from an allergic reaction. So I still feel that saline is the safest. And from a patient safety standpoint, which is really our primary concern, we feel that saline is what we have to use as the gold standard in terms of safety.
Now, what about self-exams and mammograms, and how do the implants complicate or not complicate that?
Well, self-examination is very much the front line of breast examination today, and it's interesting because people that have an implant, it actually pushes their breast further forward. So in some ways, it makes it easier to examine the breast. It's more out there. They can feel it better. Studies have been done on breast cancer related to implants. There actually are no documented studies, none, that have ever shown an increase of breast cancer in implant patients.
How important do you think this latest study is in terms of how you deal with your patients?
Well, I think the important thing to understand about this study is that in cosmetic patients, the frequency of complications is about 1/3 of what it is in reconstructive patients. The other thing is that this study really shows that the complication rate is no different than we thought previously, and in fact the rates in this study are slightly lower than those that were published previously.
Now, you mentioned that when you have a breast implant, it sort of pushes the breast out. What is the average breast size, and how has that been determined?
Well, that's a great question, and average breast sizes have been looked at many times by bra manufacturers. I spent quite a bit of time studying this with some of the manufacturers here in New York, and the average size used to be approximately a B, and that was 15 or 20 years ago. Now it's more in the C range. People are slightly heavier today. It also varies between the northern and southern climates. It varies between the Philippines, for example, so it really depends on many factors, but it's a larger breast today than it used to be.
Now, obviously, just to clarify for people who might be considering this is cosmetic surgery, so most insurances probably wouldn't cover cosmetic implants. But in terms of cancer patients, insurance companies would cover that. Is that correct?
Generally speaking, yes, but there's been a move about in Congress right now to be sure that it is covered, because there are some insurance companies that have been holdouts, that have been a little resistant to this, where they might be...
in the case of cancer, in the case of disease?
Yes. Yes, and they may be resistant to covering surgery on the opposite breast. Many times a breast reconstruction patient, after reconstructing one breast, may have a large pendulous breast on the other side that needs to be lifted and
So we
matched.
have to be aware of that and stay on top of it. Dr. Antal, thanks so much for joining us.
Thank you.